Well, if you're planning to get a vaccine, you're also looking to schedule a mammogram around the same time, doctors have some very important information for you.
Yeah, WPTV News Channel 5's Tori Dunnan explains why you need to schedule it all in a certain order.
Mary Watkins feels strongly about getting her yearly mammogram on time and equally passionate about getting the COVID-19 vaccine.
You need to do both.
She recently found out the timing of the vaccine can affect mammogram reads.
If you tell your technician, then they can be on the lookout for whatever swelling there might be in the lymph node.
Just repeating the ultrasound.
Dr. Courtney Hoey, a breast radiologist at Good Samaritan Medical Center, says they always look for secondary signs of breast cancer during annual mammograms.
We don't just look at abnormalities within the breast tissue, we also look at things like the skin and the lymph nodes in the underarm area.
She says a COVID-19 vaccine can cause swelling in those lymph nodes.
Depending on which form of the vaccine you get, it's a little bit less with the Pfizer. It's about 10 to 15% with the Moderna, but about 10 to 15% of the people will have a temporary swelling of the lymph nodes.
She says that the swollen lymph nodes are actually a good thing. It shows an immune response in your body, and the swollen lymph nodes would normally correlate on the same arm that you got your shot administered on.
The problem with that for your mammographer is that you will have new swollen lymph nodes on one side.
Her advice is to weigh it all.
We're not really encouraging delaying the vaccine because that's obviously the harder of the two things to get at this point.
Timing is key. As long as there are no breast issues, including new symptoms, pain, lumps.
You're not having any issues, you haven't delayed your mammogram for more than a year, we are saying that you can push back your mammogram by 4 to 6 weeks. You can either get it after your first dose, so 4 weeks after your first dose, before your second dose, or you can wait, if you're in between doses, you can wait 4 to 6 weeks after your second dose.
She says if you have waited some time since your last mammogram, she recommends